Profiles and Perspectives with Darswell Rogers. Profiling interesting people and exploring perspectives perhaps you've never considered.
Profiles and
Perspective.
perspectives.
And good morning. This is Profiles and Perspectives with Darswell Rogers. Today I'm broadcasting live on the WIDU network, but I am remote, and it's because I have a friend who's also remote, and I wanted to be able to capture this video-wise so I can post it later on. I'd like to introduce everyone to Dr. Shirley Jones. Shirley is a 20-plus year medical professional, and I'm going to let her tell her whole story, but she has transitioned her practice into what we call concierge medicine and direct primary care. So Shirley, welcome to the program.
Good morning.
So
Thanks for
I want,
having me.
yeah, I want you to go ahead and kind of help folks to understand, what is it that you are currently doing in terms of how you've chosen to practice medicine, and why did you decide to make this transition to this model versus what all of us are most familiar with as it relates to how we interface with the medical profession?
Well, how I started this model was I was practicing in your standard medical facilities, which, are owned by hospitals or large insurance companies or organizations. And the whole medical culture atmosphere are how we treat patients and how many patients we see are determined by insurance companies because of the payouts. And so as insurance companies and these large corporations that are for-profit began to take over the medical field, they start increasing the number of patients doctors are expected to see in a day's time, from 8 to 5 per se. And so it went up from visits being back in fee for service times. The visits were, we had time to sit down and talk to our patients, find out what's going on, and see how we can help them discuss their plan of care. It went from that to 30 minutes per patient to 15 minutes per patient. And so now you are, in my eyes, they were affecting quality of care. It was more like they were pushing the patients through. And so being trained as a physician, I went into it because, I want to try to help and heal people and help them with their healthcare and preventative healthcare journeys. So this bothered me. So after practicing in these various organizations in various levels as teacher, physician, I was the medical director, I've been in management. I just pulled out because I was like, there's got to be a better way, because I feel like it's a travesty. We're not giving people adequate health care under the name of auspices of having insurance and health care.
Well,
So I, go ahead.
Go ahead. Now finish.
So basically, I actually started doing some research, and I realized that there was this movement of physicians that were pulling away, and they're actually pulling away from insurances, because since insurances decide how we treat patients, so it's called direct primary care. So I did my due diligence with research and found out, wow, this is like the old way we used to practice medicine.
Before the insurance companies kind of dominated.
Yes, before we turn to all the different plans of healthcare now. Because it was fee for service where, you make an appointment with your doctor, you talk to a real person, they say, hello, good morning, when do you want to see the doctor? They put you in the schedule. Or if you needed to see your doctor, you could just walk in and say, hey, something, I cut my finger, I fell, and the doctor would work you in. Mm. Well, the way the payment schedules were set up with the new phases and the way we practice medicine, you're not able to do that, because it's based on metrics. And so they set these guidelines for us, and our pay and bonuses are determined on whether you fall within the metrics.
Can you said a mouthful there, so I want to deconstruct some of this.
Okay.
So fee for service, just going back to the very beginning, and my dad
Mhm.
was my dad was a physician back in the good old days.
Right.
Yeah, that was kind of the standard approach. You went in,
Yes.
you saw the doctor, and then based upon whatever it is that the doctor determined should be done, he submitted a bill to the insurance company. Now, whether or not they paid it all, there would be some dynamics, but generally speaking, they would pay it. But he
Yes.
kind of determined what it is that was going to be done. And
Yes.
one of the shifts I saw was the insurance companies started telling the doctors what should be done in the treatment of the patient.
And how much to charge, pretty much, because
And
it didn't matter what you charge. They only going to pay a certain amount.
exactly. So there's these perpetual haircuts, if you will. So if you're in any other sort of business, if you let's assume that I'm trying to pick something really silly, but you're in the hamburger business, you sell hamburgers, and your price for the hamburger is $4. But this insurance company steps in and says, I don't care how much you say it's worth, I'm only paying you $3.25. That's, if you will, to draw a real simplistic example.
Exactly.
The doctor says I just gave $4 worth of service, and the insurance company is saying I don't care.
Right. And going back to the hamburger example, is also saying that you charging $4 for your hamburger because your charges are based on what you're putting into the hamburger, your employees, all your overhead. And that's how you come up with your charges so that
Mhm.
you can make some profit.
Right.
Well, the insurance company comes in and tells you, I'm only going to pay you $2.50 for your $4 hamburger. And your hamburger it can't be a pound. It has to be a half a pound. And you can only put one tomato on it. You can only put, lettuce and mustard, but no mayonnaise. So
Mhm.
that's how they've changed healthcare.
Wow. So the notion of calling this healthcare is almost the laughable part of the whole process, I would argue.
Yes.
What is it really? What the system that we currently operate under, whereby we get medically treated? What is that? What's a more appropriate definition of what the system is?
Well, you may not want my definition.
I do want your
It's broken.
I led you straight there. I mean,
I know.
I don't want
It's
it.
a
Of course I want
broken
it. That's
health.
what.
It's a broken healthcare system that is pretty much put in a algorithm of profit. So it's not about the patient, it's not about the physician, it's about a bell-shaped curve. They look at, which, these are all things that are the bean counters, the people that are non-medical, profit-driven margins. So if you have a bell-shaped curve, 60% of your people are going to fall within the curve.
Yeah.
And then you're going to have your outliers on either side. Well, that's what they've made medicine to be. So we're only going to treat that 60%. So if you have a disease and you present that way, and that's what we do, that's what we'll pay for. So if you're an outlier, either way. So for instance, if you have high blood pressure and you have kidney disease, but your kidney disease is not at the number that start getting certain labs.
You froze
If it's
for a
not at
second.
that
So you
number, they
froze.
won't pay for it.
You froze for a second. So
Oh,
run that example back again about the kidney disease.
so like if you have kidney disease and high blood pressure. So as we know, high blood pressure will lead to kidney disease if you do not control it.
Okay.
And so you have a person that has high blood pressure that is sometimes it's controlled, sometimes it's not controlled, they're not eating right, and they have a family history of people having dialysis. And so the insurance company says, well, we will only pay for you to observe those kidneys if they fall like within a certain time frame, or if so many relatives, or I'm just giving, I'm making up examples.
Right.
So they put parameters on how. Whereas going back to when your father practiced, if we know back in the day, we had a relationship with our patients and they saw us in the grocery store. We talked if things were going, hey, Dr. Jones, can you see this? My daughter, this, and we'll meet them at the office. We knew them, we knew their lifestyle, and we knew this person with high blood pressure was going to the crab boil every Friday or Saturday, or they are taking a lot of ibuprofen because they have arthritis. So I may check their kidney function before the time frame so it takes away the autonomy from the physician and our training and our ability to practice medicine.
Wow.
They're making it more of an exact science, where if you have this, then it has to be this. And we're not going to pay for anything if you step out of the box.
Perfect. So we're talking to Dr. Shirley Jones. She is St. John's Direct Primary Care is the name of her company. She calls it Concierge and Functional Medicine. Let me note that you are down in Jacksonville, Florida, but yet we're having a conversation with people here in North Carolina. And so how exactly, given your approach to practicing medicine, how are you, because you've got clients everywhere. Explain how that works.
So how it works is I serve as so the birth of concierge medicine and direct primary care is basically to take you out of the humdrum in that factory of new medicine and bring you out where you have a relationship with the physician. Now, there are nurse practitioners that open up those type practices also. Okay. But I'm speaking about myself and my colleagues. And so we open up and we provide full service, and we provide usually for a membership fee monthly. So there are no co-pays, there's no waiting. You get direct access to me and the other physicians that practice by getting our phone number, our texts. We can communicate whenever you need us. And we pretty much help you manage the humdrum of medicine. We take care of everything. The membership covers pretty much your standard yearly physical and like 2 or 3 other visits that you want to be seen. Mm-hmm. If you have to go, if it's something that I can't do, I will talk to your specialist or refer you to the specialist when you can use your insurance. And so what happens is it's kind of like having a concierge at a hotel. We talk about what your goals are, what goes on, and we together navigate you through this healthcare maze. I provide majority of your medication, your medications, your health field, your healthcare, and we do it in person. I do virtual visits. I do home visits for people who can't leave.
So walk me through a scenario. I'm up here. I'm in North Carolina.
Mm-hmm.
Dr. Shirley Jones of St. John's Direct Primary Care. And I decide I want to sign up. How does this process work? I mean, I don't. I can't do a face-to-face visit with you, presumably, unless either you're getting on a plane or I'm getting on a plane. So how's this going to work?
So what we'll do is we have intakes and we'll talk, because it depends on what's the status of your health. If after I talk, I do a 15-minute consultation before I accept people into the practice. And then we decide, what are your goals for healthcare? Where have you been? And what are your goals, and where are you with changing and becoming? Are you open to getting better healthcare? Okay. Or are you open to preventative medicine and finding out what's wrong with you and getting everything controlled? A better life, more balance. And so what we do is, after that conversation, if there are too many issues where I feel like it needs to be in person, then I will find someone in your area that does direct primary care or concierge medicine and try to, refer you over.
Okay.
However, I do have people who, are fairly healthy. They stay on their diets, they eat right, and we're able to do virtual visits.
So, so you're not And in somebody is still going to need health insurance if they need surgery. They need some of these other fundamental things are
Right. So
still going
when
to
you
be
go
necessary.
outside of the practice, things that I don't do, you can use your health insurance. But what I tell people is to get their, first of all, to do direct primary care and concierge. You can get what we call PPO. That's where you don't need a referral from someone in the network that's contracted with the insurance.
Right.
Any physician can refer. So I
Okay.
tell them to get a PPO. And if you're fairly healthy, I tell them only purchase health, extreme healthcare insurance, which is it'll cover you if you have to go to the hospital or you're in the emergency room and things like that.
So you've got to focus on plant-based wellness. You've got to focus on, I think the key thing when coming back to the key dynamics around concierge is I'm wanting to make sure that you stay healthy, that you are healthy. If you're not healthy, let's get you healthy. How do you maintain good health? None of which the healthcare system today focuses on, right?
No,
They wait till you
right.
are sick and have a problem, and then they want to help you. So bring that piece of the equation into this notion around how do you, if you're not healthy, let's talk about how to get you healthy, and if you are healthy, what do we need to do to maintain your health?
So this is one of the reasons why I pulled out also is because being trained a physician while we were in medical school, we were never really taught to heal diseases. We were taught to write medications to treat symptoms, unless you're a surgeon and you take it out. So there was never a component of healing diseases, which I find the irony of that because we're physicians and that's our oath.
So
And so that's how I pulled out.
I almost need you to say that again. So you went through medical school, and the medical profession's focus is not on healing.
No, it's not on healing. It's on treating diseases, treating and managing diseases.
Hmm.
Treating and healing are two different things.
Okay.
Healing is you have diabetes. We deep dive and find out the root cause of why you have diabetes, and we do something about it. And I lead you in that place to treat that, and forthgoing, you know how to maintain good health. And so this is the component that I'm able to do also long distance. So with that being said, so going back to, so we are taught to write medicines to manage diabetes. Everybody with high blood pressure needs to be on, a statin.
Mm-hmm.
Yeah, the whole gamut of how we're supposed to, and we're judged on that. Insurances judge you on that. And if you don't do that, they come back and they put us in categories of A, B, C, D doctor, the ones that don't follow the rules and their rules. Okay. But it's never treatment.
Yeah, so I think that what's really important, because I'm very sensitive to not wanting to take medication, right?
Right.
I find that doctors are very quick. They'll tell me I have a problem, and I'll say, what do I need to do to correct it? They say, oh, no, I'm just going to give you a pill. I mean, literally, they will poo-poo the idea that I should do something to change my lifestyle, and they'll just prescribe a medication. That has been my experience. And so I think that's one of the key differences here is let's talk about if you want to live, because living, there's two components of it, is how long and then what's the quality of that
Yes.
living. And there's very little focus on the quality, has been my experience.
Yeah. Well, you have to understand medications produce what?
Uh,
Dollars for drug companies.
yes, they
A
produce
lot of
profit.
these people, if you read the bottom line, they contribute to these schools, they contribute to these organizations, the ADA, all of those. And so the push, as we were trained, is to use the medications. But as I practice, because I've been practicing now over 25 years, before I started the practice, I thought about at the turn of the century, we had people dying of diseases, but guess what? Now in 2024, we are we're sending shuttles to the moon. I can literally, you and I are having a conversation in, over thousands of miles away. I can have the same conversation with people and listening in another country. But there are more people dying from heart disease and cancer than they were at the beginning of the century.
Wow. Well, Dr. Shirley Jones, we want to stop here at the bottom of the hour and take a break. I'm talking to Dr. Shirley Jones. We're talking about direct primary care and concierge care. When we come back, I want to delve more into the wellness components of it. That's a big component of what you're talking about.
Yeah.
Maybe we could share a few other stories on how people should look about this. St. John's Direct Primary Care, that's exactly what her website is. So St. John's Direct Primary Care, you can find her. So we'll be back. You listen to Profiles and Perspectives with Darswell Rogers.
Listening to Profiles and Perspectives with Darswell Rogers. Profiling interesting people and
These are my
exploring
sisters
perspectives
talking.
perhaps you've never considered.
Really? Okay.
Profiles and
Perspective.
perspectives.
And welcome back to the second half hour of Profiles and Perspectives. I am pleased to have Miss Dr. Shirley Jones. She is the owner of St. John's Direct Primary Care. It's a concierge service. She is got a national practice, so she's able to provide concierge services around the country. And Dr. Jones, coming back to our conversation about the challenges with the healthcare system, the fact that it's really geared towards doctors are really geared towards managing the patient through the lens of the profitability of the insurance companies and through the lens of providing pills and treatments versus wellness and curing things. I wanted to ask you to talk about the whole wellness industry, the if you will, your best advice and insights for people in terms of how they should be treating their bodies, their well-being, and the like.
So the first thing I want to say is that we are our biggest advocate. You have to be educated about your body. You have to be intentional about what you eat, intentional about what you do. We only get one body, and we have to take care of it. We are intentional about everything else in our lives. When we decide we want to buy a house, we do our due diligence and research, and we really are intentional about getting the right mortgage, the right place to live. You go back and see, if you're building a house, you see how what they're using and making sure everything is what it says. But why is it that we do the same for hairstyles? We do the same thing for dresses or clothes or any other things that we enjoy. Why do we're not so intentional about our health? Because we're caught up in this cycle of what we thought and defined health as: you get a disease and you take a medicine for it and you're on it for the rest of your life. Well, through a lot of research, people are finding out that medical research, we're finding out that 98% of diseases and cancers are self-induced. It's your lifestyle, it's your thought process, it's what you surround yourself and your environment. And so
most people tend to think that it has something to do with heredity. My mom had high blood pressure. My grandmama had high blood pressure. Her mama had high blood pressure. So therefore, I'm probably going to get high blood pressure. But it's more likely that they were eating things that caused them to have high blood pressure, or they didn't do some other thing.
So the fact of having the genetics are there. Okay. So this is an example. So you have one brother. Their mom had, say, diabetes and ended up on dialysis. one brother gets the same disease, end up on dialysis. They have the same mom and father. The other brother doesn't even get diabetes. So how do you explain that? So that's what we talk about, nature versus nurture. You can get the genetic blueprint for the disease, but the environment of those genes, you can turn on things that will cause them to be expressed. And how you turn them on is when you eat processed foods that have all type of toxins. It puts your body in an inflammatory state where these diseases and these genetic diseases that will come out in the future will actually come out and take you down the same lane. Or you could decide, I'm not going to put these diseases and cancers in this environment, and I'm going to do the opposite to fight. I'm going to eat the right foods. There are a lot of cancer fighting foods. I'm going to get up and move, because the other thing is, as you age, there's more gravity on it. You're more exposed to all the bad environmental pollutants and everything. And so your body is full of inflammation. If you don't get the inflammation out, you will get stiff. You won't, and then people don't move, and then they get stiff. And then as we get older, we lose our balance, we deteriorate. But then there are people who, are intentional about their health, intentional about maintaining their bodies, taking care of their bodies, and realize, if I'm intentional about what I put in my mouth, what I expose myself to, and that's even your mind, we've found out people who have negative outlooks on life do not do well. They go in the hospital and they have all type of complications. And then you have people who have great outlooks on life, who meditate, who pray, who are faith-based, and they do phenomenal and they heal quicker. So there is evidence showing that we actually can make a difference of our outcomes.
So talk about some specifics. You mentioned when we were at the break, the notion of actually being able to, well, take diabetes, take one of the, diabetes is the one that I've had people who've gotten type 2 diabetes, and they don't think that there's any solution. They think they're going to be destined to be on a drug the rest of their lives. And there's nothing I can say to them, even though I've seen the research, that would contradict them, but they're committed to what it is that they believe. So use
But
that.
those people haven't met me and all my other colleagues. So I'm going to give you a personal experience. So at the age of 36, I had my daughter. I was in residency training as an OBGYN doctor, very high stress. Everything was high stress. I became gestational diabetic, and I was put on all type of insulin and all of that. I had my daughter, came out of the hospital. I had really very bad postpartum time because I was very, very sick. They wanted to take my kidneys. They couldn't get my blood pressure down. Had a lot of issues. So over the years, gestational diabetes usually goes away, but it can rear back up. It puts you more likely to have it again. So it did come back with a vengeance. And so I was like, okay. And that's during the time when I started doing my research about, there has got to be a way that I can get this controlled by not taking all these medications. Because I was like, how am I a physician and I'm taking all this medication? And so I started doing my research, and that's when I went vegetarian. And when I went vegetarian, and I was very specific about being intentional about, looking at what I was putting in my mouth. I was actually moving. I was, eliminating sugars and eliminating fake sugars. If you're going to do sugar, you do real sugars, which are not white sugars. It's your turbinado, your cane sugars, those type of sugars. Or you can use dates. There's date syrup. So I went from being on 4 insulin injections and pills to no insulin and just 2 pills by just changing lifestyle. And so then, when I went through menopause, everything went awry. The hormones kicked in or left or whatever was keeping me. And then my A1C started going back up and I could not get it below 8. And we usually want less than 7. And so that's when I start doing more into functional medicine and studying functional medicine, lifestyle medicine, and realize that you can cure these diseases. Our bodies are phenomenal organisms that were made by God, and they have ways to cure ourselves if we get back to the way we're supposed to eat and what we're supposed to do. And I actually cured myself. Right now, I'm in my 60s. I'm on no medications. I dropped like 60 pounds and I'm vegan and I don't have my A1C is like 4, non-diabetic range. So I cured my diabetes.
So let's kind of cut to some of the dynamics. We're my audience, we're kind of highly invested in the Southern cuisine.
Okay.
Can we get there without being a vegan? Let's just kind of cut to the chase. Can we get to where you are and still have at least some kind of meat in our diet? Is that possible?
The problem with meat is, number one, the meat that you're buying from the grocery stores and all these meat places has been dead forever. Because there's no cow outside that somebody chopped up, knocked it, and then they came and then cooked it. So you're talking about it had so much processed chemicals and dyes in it that those dyes and chemicals are known to be hormonal dysregulators, which mean they affect our hormones, which mean we're not using the hormones in the right way. And it causes inflammation. It causes our bodies to be more acidic, which is having a positive charge, which is the perfect environment for sickness and for cancers. That's what cancer's like. The oxidative stress of that environment, of everything positive. And so eating the meat out of the grocery stores, I mean, because let's use Florida as an example. We don't have dairy farms in Florida. So the pigs, the whatever the other type of meat that you eat, you chop it up, it stays in the warehouse. They give it all this so it won't turn black, because anything that's dead turns black. So they pump things so it keep that color. And then they put it in the freezer, then they ship it. So from the time it was killed to the time you eat it, probably is almost a month. So you're literally eating dead meat. And so all the nutrients are gone. Now, if you can find fresh meat, because there are places that are whole food places where you can get grass-fed beef and it has the date, like when it was slaughtered and things like that. And there are places that do that and they overnight their meat and things like that. But that's what I'm talking about, being intentional. So if you're going to eat the meat, you can eat your beef. No one should ever eat pork. Pork has put more Southern cuisine people in the casket earlier than ever. It is just not an animal that has anything that's comparable to help our system. It throws us into a whole nother issue. But you can do beef, you can do lamb, but you try to get the fresher grass fed.
How about fish?
Fish is fish, not crab, not shrimp. Those are bottom feeders. They actually clean up the ocean. So you're not getting anything from that. It's like eating a cockroach. And plus they are high in cholesterol. They eat waste. So this is not an animal that we should be eating. But you can eat fish, like, good fish.
Yeah.
Like salmon. Yeah.
Yeah, you're just
some of the other ones.
You're devastating me in some respects here. I just want you to know, and I know
it's high in salt, it's high in cholesterol, it's high in mercury.
Listen, I know better. I like bacon. I have reduced it to just the weekends, and I tell myself, okay, I'm going to break this habit because I can't eat something other than that.
Yeah, they make turkey bacon, they make vegan bacon,
Well, yeah,
plant bacon.
if it's a vegetable, I just assume it look like a vegetable. You don't need to fake me out and make a vegetable look like a piece of meat. That's never going to work for me. Listen, we're talking to Dr. Dr. Shirley Jones. Uh, she's the owner of St. John's Primary Care LLC. That's exactly how you can find her. St. John's Direct Primary Care. She's down in Jacksonville, Florida. She does concierge medicine. It's basically a monthly fee. You get direct access to her, video, phone, text. You know, when we have these challenges, and we've all been through it, where we've got a problem, the primary care physician is saying you can't have an appointment until a long, long time. They'll literally say, well, go to urgent care. Then you got to deal with the whole urgent care environment. You got to deal with the emergency room environment. And you're not going to get a person who knows who you are. And I think the key dynamic here is that what Dr. Jones is offering up is an opportunity to speak to the person directly. They're going to get to know you. They're going to get to know what your objectives are, what your challenges are, and to be able to treat you as an individual instead of you as a number, which is the way the insurance industry generally is driving the medical profession. Did I do a decent summary?
Yes, you did. You did an excellent summary. It's
Okay.
about relationship. Healthcare should be about relationship. We partner to help you live better. And so the thing that really works with this partnership in all of the direct primary cares and functional medicine is the person who's seeking the help. Are you willing to change? Then that goes back to the mindset. Are you willing to change? If you're not willing to give up your bacon, there are consequences.
There are consequences. But you could at least concierge me around my bacon. Okay, I got one bad habit. I'm going to exercise 5 days a week. Tell me how many vegetables I need to eat. Tell me about my meditation and my prayer. You know, kind of talk. That's a great place to go. Talk a little bit about what an example, somebody who's come in reasonably in good health or not in great health. You know, where are you trying to take them to?
So actually, I have a program called Aging Gracefully from the Inside Out, and I want to partner with people who want to live longer, because it's about the quality of life, who want to live longer, and you don't have any medications, you look great, you don't look your age, and you're able to get up and move and do things with your family, and you just have a wonderful life. Because wealth is not money, wealth is health. If you're not feeling well, you can have all the money in the world. You can't use it. You're not going to be happy because you're in pain or you're stiff and all of that. So my goal is to help people who want to make the changes to get there by providing them. And some of them, you know, are very, very extreme changes because we are trained to believe, oh, you know, one of the issues is the Southern cuisine. The Southern cuisine came by because the slaves had to make the best out of what they had. It was the leftovers. It was the junk. But their junk for food was different from our junk because all our food now is processed. Their junk was real food. It was the leftover from the actual vegetables they grew. It wasn't all the pesticides. It wasn't all of the, you know, the other things. So it really, you have to bring it back to the time frame and to what goes on now, because our overall economy and how we eat and what's put out there is totally different.
You know, you've changed my entire perspective on processed, right? Because when you said processed, I'm thinking, yeah, that's lunch meat, that's bacon, that's hot dogs. But you're now telling me that kind of the entire meat industry is processed, which I hadn't
And
thought
food,
about.
period.
Huh?
Food, period. Anything that doesn't come directly from the ground is processed. If it's made in a production building, that's processed. Real food doesn't come from a production. It doesn't need to go to a factory. Real food, get a real tomato, it grew out of the ground, you pulled it off the thing. And you can grow your own vegetables in pots.
Right.
You know, off the, you know, or you can go to the farmers markets and the little markets, and you can tell which ones are real because they got dirt on them, and the person selling doesn't have a ton of them. It's a few. And those are the things that you eat. You eat fruit that's in season. You should never eat a piece of fruit that doesn't have a seed. If you do, that's fruit that's GMO. Because how is the fruit supposed to reproduce if it doesn't have a seed? That's the definition of fruit. They have seeds. And so if you're eating things like seedless watermelon, all that's GMO. That is genetically modified, altered, which means chemicals, which means, and our body doesn't know how to digest that stuff.
So we've got 5 minutes left here. You have a little bit, and I thought I knew what you're going to say. I thought I knew what you were going to say, and I'm
Did I
like,
step on your toes?
What's the encouragement? Give me some,
Encouragement means, you have to be willing to change. You have to be willing to get beyond the stigma and the thought of, I gotta have this food, and realize the way we're eating, African Americans die from all diseases more than any other race, because we will not let go of old traditions. We would rather just die with our family when we don't have to. There is all type of evidence. You can see people, and you don't have to be a vegan, you're right. But if you can just get fresh meat, get fresh fish, not the crab, all of that stuff, that is just that's not stuff we're supposed to be eating as human bodies. A lot of this stuff was introduced for money, for greed. And so it's just being open enough to realize, I want to live. I'm going to be intentional about living longer by making changes. It's the same thing we do about if you have bad credit. It's the same thing you do if you realize, I keep going for a job and I can't get it because I don't have enough education. So I sit back and say, okay, I'm going to break down and I'm going to have to teach myself how to study and go back to school. It's mind changing.
Well, the thing that the thing I have to own from this conversation is that I speak to leaders inside organizations about the fact that if you want to keep all your bad habits, I really can't help your business to progress in a different direction, because everything starts from the inside out. It starts, it starts from the inside out. And if you've pointed out to me that I have more work to do, the 40 pounds I lost is all well and good. But if I'm planning to live to be 120 plus and be active, I don't mean just sitting on a stoop someplace, but being able to move around. Yes, I'm doing the exercise, and yes, I count my calories. Yes, I meditate and pray, but I have not wrapped my mind around this idea that everything I put in my body is processed. Because even the vegetable that's sitting in the fresh section, your point is they did something.
It has pesticides.
Yeah.
So you need to do organic.
Yeah. Now this is we've only got a minute left here. This sounds expensive. All right. And I'm talking about this food shift. Sounds expensive. But we don't. I'm just going to have to bring it back. I realize there's just no way we're going to cover what I want to talk about. So this is the Dr. Shirley Jackson. What's your phone number?
904-569-7984.
Say it again.
St. John's Direct Primary Care.
904-569-7984. St. John's Direct Primary Care.com is the website.
Yes.
And
I'm on all social media platforms.
Okay.
YouTube. I do a lot of videos. Yeah.
Okay, so now that I still got a minute. So I just wanted to say, give me 60 seconds on how does one manage this affordably? Because, going organic, that's more than a notion for a lot of people financially.
So going organic is you go buy organic seeds from Lowe's, Home Depot, or the plants, and you grow them in a pot. Whatever vegetables you like to eat or fruits, just go grow it in a pot off your balcony in season.
Okay.
And then, you know, because then you don't have to buy a bunch from the grocery store and they all go bad, or they don't go bad and they stay in your refrigerator for 2 weeks.
And you know it's a problem if it doesn't go bad. That means it's really been
Right.
processed.
Yes.
Listen, we've reached the end of the program. Thanks so much, Dr. Shirley Jones, St. John's Direct Primary Care. Everybody have an outstanding weekend. You listen to Profiles and Perspectives with Darswell Rogers.